Hey, my name's Dr. Justin Baker. I'm a sports chiropractor at Trinity Sports Medicine. My role in the balance and vestibular program is really to assess the cervical component or the neck in what happens with people with balance issues. Quite often when the cervical spine is compromised or, for lack of better terms, the neck isn't moving appropriately, this can throw off the proprioceptive system or our balance system. So assessing this appropriately in a timely fashion is critical. So addressing the cervical spine or the neck component of balance really starts with assessing the proper range of motion in the joints to see if they're moving properly. So in our older population, quite often there's some cervical arthritis or some other conditions such as trauma or other things that might have caused a lack of mobility. That creates compensation up and down the neck and the spine, and it also changes the way we balance. So in an effort to kind of correct these things, you need to work on the neck and then give some proper functional or stability exercises so that it lasts long term. Once you've done that, it's really critical to make the right referral to get the patient to balance and use their posture more appropriately. So that's why we have the great vestibular and balance program that we're building now, so that these individuals get the help they need. Part of the multidisciplinary approach here at Trinity Sports Medicine is the unique opportunity that we all have a team approach to assess these patients. For instance, somebody might come into my office with a certain complaint that might be better suited for another specialty, such as physical therapy or aquatics or balance, right? All these things have a play in the patient's improvement. So the best part is to utilize them. So if I can't help somebody, I know where to send them. And the same goes for these other physicians here and other specialties. If they think that maybe a different perspective, such as the way they function or the way their cervical spine moves, or a better approach to maybe a global exercise pattern or prescription, they send them to me. So that's kind of how I see my role here at Trinity Sports Medicine. So quite often we get patients at the Trinity Sports Medicine Center from the emergency room, for instance, or in inpatient rehab after somebody might have fallen or they have a balance issue. So once they've kind of gone through the inpatient rehabilitation program and have seen the appropriate specialists to carry that out, then they come to our office and say, well, what do I have to do now so that I can transition more appropriately into my daily living? So that's kind of where we take it and assess things a bit differently and take it to the next level with a bit more performance-oriented things, such as I want to climb the stairs better, so I need to get better core and hip stability, or I need better balance. So these are all things that we can address here to try and get patients moving in a more progressive way forward. So once the patient has kind of completed their formal therapy and improved their balance and vestibular components to an appropriate fashion, it's really important to kind of keep them moving in the right direction. So that's where we transition them to more of a wellness approach with the YMCA and getting them involved in maybe a class like Silver Sneakers or encouraging more walking. These things are all trying to keep them a bit stronger and keep their core and their hips moving. It also, kind of the old adage, if you don't use it, you lose it. So it's really important to keep these seniors and other people with balance issues that have maybe some neural issues to keep them moving. So a lot of times you might question whether or not you might have a balance issue or some cognitive issue where you're not thinking clearly. If you think that might be an issue, well, get yourself checked out. It's pretty innocent. You just come in and talk to the people that you need to, and we take a look at you and see what kind of service you might benefit if you need anything at all. If you don't, we say, hey, go on your merry way. But if you need some treatment, such as some vestibular balance therapy, maybe you need to work on some cognitive things, we have all the tools for that. So don't be afraid to get assessed.